Psychopharmacology. This is basically medications that we are taking, prescribed medications to help manage anxiety. I want to talk about some of the different things that are often prescribed for anxiety, panic attacks, and different stuff like that. Because sometimes the confusing part is you might go into the doctor and they give you an antidepressant and you're thinking, why am I being given an antidepressant if anxiety is what I'm struggling with? So we'll get into that. We'll talk about why, we'll talk about how it helps and the experience that I've seen working with people, okay? So the first thing I want to talk about here I have on this slide is the flotation device analogy. And I ended our last video with that, but I'll go ahead and mention that again because I think it's a very powerful metaphor. And that is sometimes when we're struggling with something, depression, anxiety, whatever it may be, we're talking about anxiety here. It may feel like you are drowning. You are out in the middle of the ocean. You cannot keep your head above water. You don't know what's coming at you left, right, from below. And you just are struggling to just stay alive. Okay. And this is real. This is a real deal for many people. And that might be you. And my heart goes out to you. That's why I'm making this course for you. So what this can do is it can be like a flotation device. It can be that thing that is like a lifesaver, life preserver. So we've got the life jacket, we've got the circle, we've got the small boat. It's not a yacht, okay? It might feel like that for some people, but my encouragement, it really can feel like that for some people once they start taking it. It's like, oh my gosh, this is huge. But my encouragement is to still do the work, okay? And it's okay if you need this for a short time. It's okay if you need this for a long time. That is okay. And one thing to be mindful of, often people who struggle with anxiety, when they start taking some of the medications that are specifically for anxiety, they're kind of like sedative types of the Xanax and stuff, they often want to carry them with them in their pocket for the rest of their life because it's that kind of that safety net for them. And they may never ever use it again, but there's this kind of psychological dependence on it. And we'll talk about that. And we have to be mindful with some of these because the reason why those anti-anxieties are not, like Xanax and stuff, not always the first line of defense that a psychiatrist is going to give you is because they're extremely addictive. And what happens is you need more and more over time to have the same effect. And then you can't just stop taking them because it actually can have a very significant effect on the nervous system and your whole body. So you kind of have to detox off of it. So as I talk about this, I know those of you who might be watching this video have or this whole course have gone and come into here because of the integrative and holistic approach. But I want to tell you, sometimes it's necessary and that's okay. All right. So just take a breath. Please forgive yourself. Please understand that that's okay, because sometimes to do the stuff that I have talked about for hours in the seminar can seem impossible. To get up and go for a walk, to make yourself some food that is healthy for you, to order supplements. And some of the supplements are really expensive. I'm not going to lie. Okay. Some of these treatments are very expensive. And we do what we can within our means. But I want to be realistic, and I will also I just want you to know and understand and be fully educated. And if this is a route that you have to go, it's okay. Totally okay. I still encourage you to do all the other stuff, like especially the work that we've been talking about, being aware of your feelings, connecting with what's going on, setting boundaries, working towards exercise, all of that stuff. That stuff doesn't really cost much. That doesn't cost anything. I mean, it might affect some relationships, but I encourage you to have healthy relationships. And if you can't set boundaries with some people, if you can't acknowledge what you're feeling, we need to take a look at some of those relationships. Okay. All right. So antidepressants. So yes, antidepressants are often one of the first lines of defense given when somebody is struggling with anxiety. Okay, so I have this list of antidepressants that are commonly prescribed for anxiety. I've listed here the brand name and the generic name. So I know sometimes it can be confusing, especially when you're like really overwhelmed with stuff. You might get something and it has one name and then you find out that, wait, I already took this or something similar. And this is the reason why. So basically a company creates a drug and it helps for something, and they have the rights to sell it for like a super expensive amount for a long time, and they are not releasing what is in the drug. And then after a certain amount of time, they will release what the compounds are in that drug. And then so a generic one is made, and insurance like to use that one because it's a lot cheaper to make that mimic than it is to use the original one. Okay, so I'll just go through the brand names because otherwise I'm going to be here trying to pronounce all these other ones, but you can see here on on the other side, what the generic name is. So we have Prozac, Zoloft, Celexa, Lexapro, Paxil, and Luvox. The ones that I often see prescribed, most often from psychiatrists, are the Zoloft and the Lexapro. It doesn't mean that the other ones aren't beneficial. They are. Everybody's makeup is a little bit different in how they respond to some of these. So there's the SSRIs, which are the selective serotonin reuptake inhibitors that increase the level of serotonin in the brain. They're usually the gold standard for panic disorder and generalized anxiety disorder. So here we have again, Prozac, Celexa, Lexapro, Zoloft, Paxil, and Luvox. So it takes a few weeks to really start working. Some people will feel results like pretty quickly, but they say it takes 4 to 6 weeks before you fully feel the effects of the medication working. And sometimes there will be some side effects at first, like nausea and headache, and sometimes that will, not sometimes, it usually passes. And then it says here, don't stop cold turkey, because that can cause dizziness, nausea, sluggishness, depression, and increases within 2 days. So you want to make sure that if you decide to get off of that, you can, probably work with your doctor or even talk to the pharmacist about titrating off. That's what it's called, is when you slowly get off of it. Because I've had clients just stop taking it and they get these weird buzzes and zaps and they feel just horrible. And we don't want that to happen. So the SNRIs are the serotonin and norepinephrine reuptake inhibitors. They increase the level of serotonin and norepinephrine in the brain, and they also treat nerve pain. So these are going to be the Wellbutrin, XR, which means like extended release, Pristiq, Cymbalta, Effexor, XR as well. Okay. The TCAS are used when SNRIs and SSRIs don't work. We also have, let me see here, I think I have a list of what those ones are here. So Pamelor and imipramine, that's what those ones are, the tricyclic antidepressants. Okay, so then we're going to go to the tricyclic, okay, I have that, it was right there. Jumping back and forth between things, excuse me. So these ones are kind of intense, right? So they require an EKG and blood level monitoring. So these ones, they're not often prescribed, but if they are, you want some of this stuff. And I really like, if you're going to get on a medication, that there's blood work done first. So they're checking for all this stuff. If you have a really good psychiatrist, they're going to check for all the stuff that we talked about before. Do you have deficiencies in certain things? How are your thyroid? How's your thyroid? How's all this other stuff doing before they just put you on stuff? Okay. MAOIS, so monoamine oxidase, this is a hard word for me, oxidase inhibitors. Those are rarely used, and that's Nardil and Parnate for panic. And with that one, it's kind of gnarly because you have to avoid certain foods that have tyramine, and it's most cheeses, sour cream, homemade yogurt, red wine, vermouth, liqueurs, beer, aged meats and fish, overripe bananas, avocados, and more. Also, you can't take over-the-counter cold remedies with this. So it's really important to know what you're taking, and I would hope that if somebody was going to put you on something like this, they would talk about this. Now, this long list of stuff is part of the reason why people are like, hell no, I'm not taking any of that stuff. And I get it. You don't give me avocados. Like, I need to eat avocados. And bananas, I love those. But when we're in a desperate place and we're not able to function, this is why some of this stuff comes up. And I've never heard of anybody on these, but in my research and my training, I did like a whole courses. I had to do a course in pharmacology when I was in grad school, but stuff has changed, medications are changing. I did extended courses on this, and they talked about some of these. So with this one too, it's very serious. If you take the stuff, it can cause a hypertensive crisis, so very high blood pressure, severe headache, stiff neck, nausea, stroke, or even death. This sounds like one of those commercials. Like, here's this wonderful medication you can take with all these side effects. And with this one, it's a delayed onset for medication to work, weeks to months for full therapeutic effect. So the message here is you don't want to start with something like this, okay? You can go in if you're really needing it and be put on one of the other things. Hopefully it would be one of the things that we first started with. And also an important note I want to say here too, is that, let's see here, I got to go back to my slides here. Excuse me one second. So as I'm recording this, it's a little bit different than what you're seeing right now, and my slides are being funky. But what I want to say to you too, is that if you start to notice a drastic change in behavior, you are now feeling great, which is wonderful and awesome. But if you start spending a lot of money, you start going out and doing some behaviors that are just not normal and like you, maybe lying about stuff, going around, sneaking around. If you're married, you're talking to somebody else that is not your spouse that you shouldn't be talking with, doing stuff like that. You need to pay attention for that, because sometimes some people do have bipolar disorder and they might not know until like really fully until they start taking an antidepressant, and then it's basically a manic episode is what starts to happen. And it can be like a keyed up slow version or real quick, but when you've been in a place of severe anxiety and kind of maybe not functioning, it may seem normal at first because you're getting up and you're moving around, and that's amazing, right? Of course I would want that. But we need to be aware of some of this stuff, because some of that doesn't come out until you take an antidepressant. And then there's ways to help balance mood and different stuff like that. Okay. So the next thing would be the anxiolytics, which are often probably what you think about when you think about medications for anxiety. So we've got Valium, Xanax, Ativan, and Klonopin. Some of these, if somebody goes into the hospital and they're having like anxiety, full-blown panic attack, they're going to give them Ativan. They're going to give them, they might give them Klonopin. They might even put it in the IV, and it will just calm down. The hard part is about these is they work, and they work very well. And because they work so well, they're extremely addictive. And this is something that I really want you to be mindful of. This is the like major life preserver. The boat is going down, and then I use that. Valium is something that used to be prescribed all the time, and people are just kind of high on this all the time, just functioning. I think it was like kind of jokes about the, in the 60s, just the housewife being on Valium to just deal with having to deal with being at home and deal with everything. But I've known a lot of people who unfortunately have had to go through detox and rehab for Xanax. And there's some psychiatrists who won't even see clients if they are on Xanax or a high dose of it, just because it's, it's a challenging thing. So not to say you can't get help if you are, but being mindful of that. Don't be surprised if something like that happens. I also want to make sure I talk to you. There are these things called, the gene insight test, and there's other versions of it. And basically what this does, some psychiatrists will say it's a bunch of, BS and it doesn't work. I literally have met people who say that. But people who are in the integrative and holistic field really believe in these tests, because what it does is it will basically tell you how your body is going to, it's metabolize, but how your body will react to different medications. So you'll take this test, and I forget if it's a cheek swab or a blood test, but I'll put a link in here for it for you. And what it does, it'll spit out all the different medications, especially like the antidepressants and the anti-anxieties and all these other ones, and it'll give you red, yellow, or green. So red is your body metabolizes it in a way that's kind of no bueno. You may take more of the serum in, so maybe you're taking like a Lexapro, and Lexapro for you might cause like a really intense like uptake of the serotonin, and you might be more likely to have kind of more of a manic episode, even if you don't have bipolar disorder. But just, being aware, because what I've seen otherwise, it's a shot in the dark sometimes when you go to psychiatrists, and they're just like, let's try this, and let's try this, and we'll try a mix of this and this. And this is a reason why a lot of people don't like to go to psychiatrists, because you're just kind of a guinea pig with some people. So I really want you to make sure that when you meet with somebody that you feel heard, you feel like they're really taking you into consideration. And if you're watching this video, you're probably because you're more into integrative and holistic approaches, you want to make sure that they're looking for some of this other stuff, that they know at least something about the way the body works. I mean, they're MDs anyway, but that they're taking a look at, they want to do a blood test for you to figure out, make sure you don't have, high blood pressure and all these other issues that could possibly be contributing to anxiety. So, and I've seen now even some of the online psychiatrists that, BetterHelp, or I don't know if BetterHelp has the psychiatrist, but there's lots of different sites that have them, and they'll say that they will test that I'm saying Gene Insight here. I'm going to put a link for some of the other ones, but that they will look at that and take that into consideration when prescribing medications for you. So red is don't take, your body probably will not react very well. And maybe it's the side effects. Maybe it's going to be really bad side effects for you that won't work, that are going to be really unpleasant. The yellow would be, we're kind of, maybe, and then the green is a go. So if it were me, I would start with the green. If the green isn't working, we can move up to the yellow, and then we can move to the red. So I just wanted to educate you on some of these things so you don't go in completely blind, and you understand if you end up going, sometimes MDs will prescribe this stuff too, just like your regular general practitioner, because psychiatrists are also MDs, but they specialize with the mental health aspect. So I want you to know what to look for. So somebody who's going to listen to you, somebody who's going to really hear you and take into consideration, like, hey, I like to do stuff more natural if possible. I've heard about this test that can be taken that will really show how my body will react to certain medications. And it has to do with the way your body metabolizes it. So that was one interesting thing that I learned from some of the seminars I did with the psychopharmacology of the medication. And then just understanding why they might give me an antidepressant if I am anxious, because if they go and they just give me those anti-anxiety pills, they're extremely, extremely addictive, and you need more and more over time. They need to be looked at more of like a parachute if needed, not like an everyday thing. Have I seen some people that are on that every day? I have. I'm not going to lie. I have. And sometimes that's necessary, but I don't want us to start there. That's definitely not a place we want to start. So hopefully this information can be very helpful if that's something that you need. And please, I don't want you to feel like, what is wrong with me that if I have to take this? It's okay. It's totally okay. It's all about being able to find ways to live life and enjoy life and love life and be able to just get out there and live and connect and be able to breathe. So I hope that this has been helpful for you. Thank you.